Okay, so we're having a broad introduction to, mainly we are trying to look at the types of monobactam drugs. Of course, they are a type of what? Antibiotic drugs. Okay, so let's look at the monobactams. Alright, so for the monobactams, we say that they are a unique class of what? Beta-lactam antibiotics. They contain a single beta-lactam ring. So unlike other beta-lactams that have fused rings, so that's why they call them mono. They just have one ring, a single ring. So they are narrow spectrum. Of course, they don't act they don't act on many organisms. So they are narrow spectrum antibiotics. The primary what affects aerobic gram-negative bacteria like Pseudomonas aeruginosa, Neisseria species. Their mechanism of action is they bind to penicillin-binding proteins. They prevent the peptidoglycan to interact and make the cell wall stronger. So this can now make the cell wall prone to all sorts of attacks, So they are resistant to many beta-lactamases, making them useful for drug-resistant infections. So if you're dealing with a drug-resistant infection, you might just want to employ these guys on it. So for the different examples, we have what? Aztreonam is the most widely used monobactam, effective against gram-negative infections mainly. Then next we have the Tigemonam. Right. Then we have the what? Carumonam and Taptoxine, less commonly used but show potential in bacterial treatment. I think this is Carumonam. It's coming here to show you guys. Alright, so clinical uses is generally what? Urinary tract infections, lower respiratory tract infections, septicemia, that's bloodstream infections, skin infections, then peritonitis and what? Endometritis. So advantages is no cross reactivities with penicillin. So there's no drug reactions with penicillin. They are effective against bacteria that have been resisting a lot of drugs. Synergistic with what? Aminoglycoside enhanced antibacterial effect. Limitations is they have limited actions against gram-positive bacteria. Alright. Not effective against anaerobes, and they have side effects. Okay.